How important is the concept of leadership, span of control, and creating an environment that not only attracts but also retains healthcare professionals?
So that is probably the hottest topic you hear about today coming off of this pandemic when you look at the literature and the evidence. I'm part of two huge work groups that are really studying and pausing and describing what does the future look like for span of control for nurse leaders. Both the American Organization of Nurse Leaders, AONL, the Academy of HMA, they are studying this as I sit here today. So I would say to you, within the next 6 months, they are going to publish some evidence-based, refreshed literature coming off this pandemic on what is the design of span of control, because it is it is vital to address retention. They go hand in hand. We could not expect that nurse leaders carry a huge span of control and produce the retention metrics that we need produced, and not a revolving door of talent. It's all about bringing them in, very candidate-centric, and retaining them at the end of the day. The revolving door needs to stop.
Absolutely.
And span of control is front and center to making that happen.
What are some of the current spans of control? Because it does feel very big. And I've heard from some of our clients that anywhere between maybe 60 to 100 nurses per nurse manager.
That's correct. And so where is the best practice? Who has the best evidence proven by the outcomes of retention, patient satisfaction, hospital-acquired infection, harm factors, the onboarding of the new graduate? Who has the best model, and what does their span of control look like? And what supplemental ancillary support are surrounding that nurse leader in terms of educators, supervisors, clinical coaches? It's all the full package. But right now, the span of control is all the way from A to Z. No one really can articulate by the evidence and the literature and the strong research, where do we need to land that plane?
Man, I can't imagine. I've done so many different organizational designs, and I don't think I've ever tried to organizationally design any manager that had more than 10. I mean, literally, I just can't imagine having the performance coaching, having just the one-on-ones, just the check-ins.
Relationship.
Yeah,
Right.
like just getting to know them on a human level, getting to know their family, right? Because when you come to work, you are creating a community and you're creating that dream team, right? Like you have a team that you want to be surrounded by, and your leader is the one who determines kind of the end state. A lot of actual doctors right now are saying that your manager will actually determine your health. And that's because of all the stress and the cortisol that's exerted. So anybody who is dealing with any type of belly fat, you can actually thank a lot of your managers for some of that as well too.
Right.
So.
And so let's not forget that front and center to being employee-centric and that great experience we want every candidate to have, we want the same for the leader.
Yep.
So you cannot address retention and recruitment without looking at leadership, retention, and recruitment. And they're shopping for the same thing that some of our employees are looking for: work-life balance, being able to meet their calling, being able to be present and build those relationships. And if the span of control is too large, that is next to impossible to do for any human being.